हाय सो दिस इज द सेकेंड पार्ट ऑफ द वीडियो। हमने कल एक केस डिस्कस किया था, आज मैं उसको आपके एक फोटोग्राफ दिखाता हूँ। सो द पेशेंट केम यस्टरडे। व्हाट आई डिड इज, हमने उसको एनेस्थेटाइज करने के बाद एक पेरिडोंटल प्रोब रन किया फ्रॉम मीजियल टुवर्ड्स डिस्टल। मीजियल जब हम प्रोब रन कर रहे थे, देयर वाज अ पॉइंट जहां पे पेरिडोंटल प्रोब गॉट टोटली इंसर्टेड अराउंड 10 to 12 मिलीमीटर्स इनसाइड द जिंजाइवल सल्कस। बाकी एरियाज में देयर वाज नो पेरिडोंटल पॉकेट, सिर्फ इस एरिया में देयर वाज अ डीप पेरिडोंटल पॉकेट एंड दिस इज द साइनस दैट वी वर टॉकिंग अबाउट यस्टरडे। सो आई आस्क्ड यू ऑल, डॉक्टर मंजू आई रिमेंबर, उन्होंने कमेंट किया इसमें दैट देयर वाज अ परफोरेशन विद द वर्टिकल रूट फ्रैक्चर। I would like to tell you, इसमें कोई perforation तो नहीं था, but this is a case of a vertical root fracture. Now, how did we diagnose it? See, there are three particular features about vertical root fracture that distinguish it from the other clinical diagnosis. First, there has to be a narrow, deep periodontal pocket, such as in this case. आपको और कहीं पे पेरिडोंटल पॉकेट नहीं मिलेगी, जस्ट एट अ पर्टिकुलर पॉइंट आपका पेरिडोंटल प्रोब विल रन डीप इनसाइड द पॉकेट. सो देयर हैज टू बी अ नैरो डीप पेरिडोंटल पॉकेट. The second feature that helps us in identifying a vertical root fracture is that there has to be a J-shaped radiolucency when we see the X-ray. I'll show you an X-ray in a while. So there has to be a J-shaped radiolucency. The third thing that distinguishes a vertical root fracture from other clinical diagnoses is that sometimes we see something called as a cement trail. Now what cement trail is, you can just Google it and just see the theory. Sometimes the sealer flows through the fracture line and you can see a cement trail. So what we know till now is there has to be a deep narrow periodontal pocket, there has to be a cement trail, a J-shaped radiolucency. So these are the particular features that we look for while diagnosing a vertical root fracture. So in this case, typically there were all the factors that were helping us in distinguishing the vertical root fracture. So what is the treatment plan? There has to be, the tooth has to be extracted. We had to extract the tooth, and in this case we curetaged the area thoroughly and we placed an immediate implant. So let us go to the X-ray. So as I was telling you, there has to be a J-shaped radiolucency. Now carefully see this area. There is a J-shaped radiolucency here. Okay, I cannot see the cement trail in this case, but I must tell you one more thing. While what I did is, through the sinus tract I placed the 25 or 20 number 2% GP into the sinus tract. And ideally what happens is, when this is an endodontic lesion or an lesion of an endodontic origin, the gutta percha should go and come at this tip, root tip. While taking the X-ray you can confirm that. Whereas in my case it was coming at around this area, at the trifurcation area. So this also indicates that this is not an endodontic lesion, this is lesion of some other factor. So this is the second thing that we can use here. And the third is, of course, a deep narrow periodontal pocket that helps us in distinguishing a vertical root fracture. So this is how we diagnose a vertical root fracture. And just let me know if you need to ask anything else regarding a vertical root fracture diagnosis. And cheers.